All right, so here we are going to take a look at your back. And you said that when you bent forward on the right leg, did you say?
Yeah, I was there the other day. I was noticing it on the right leg. Yep.
Yeah, okay. So usually when people are having shooting pain, how far down can you show can you like tell me, was it past the knee? Was it
I would say like right around the knee area.
like like right around this area?
Yeah, probably right around there. Yep.
Okay. And what activity were you doing there?
I was just sitting on the couch and I got up, and then I noticed it, because I think it was that rainy day. We weren't doing much. It was really rainy here, so we were just sitting around all day, and that's when I would notice it. I would get up and that, up and down. It was just like stiff, and I was getting those shooting pains down there.
Okay. What did that shooting pain feel like to you?
What'd you say? I couldn't hear you.
What did that feel like to you?
Um, I don't know. It wasn't like a constant. It would just come and go,
Okay.
like a
Okay.
pin, like pinching.
Okay. So oftentimes what can happen is that you can irritate the lower back or the sciatic nerve that comes down, and based off of like your MRI and going over stuff with you, you definitely have some compression, and that's why sometimes some days are good and some days are bad and stiff, and you can probably accelerate through, in my opinion, based off of the course and the things we're talking about. I think you can accelerate a little faster probably through the pain relief phase. And I don't want to say don't jump over it, but don't like think that you need to stay there for as long as some people. So
Okay.
some things may not apply to you, just but that's why that's why we'll consult and talk about that.
Okay.
But like in this case, like what you can do is you can irritate that sciatic nerve or that nerve that goes down, and it branches. And usually, a lot of times, people will feel it like right behind the knee. So if you think
Yeah.
about this,
Yep.
this position at the branch of that sciatic nerve, it's give or take anywhere between 3 and 5 fingers up from the back of the knee, from the crease.
Yeah.
That's what this is. So that's probably
Sounds
why
about right.
one of the reasons why. So the good sign for you is that it's not going past the knee, because every time it goes past the knee, every joint that it crosses, if it goes to here and then it goes further down, the harder it is or the more compression on that nerve there is. Just like stepping on a hose of water, the further you compress that hose, the less water is going to come out the end, right?
Right.
So we're going to be compressing it. Bad certain positions, you're going to notice more compression. Typically in the spine, it's more flexion or bending forward, like bending down, touching your toes, or rounding the spine. That's because
Right.
when when we I'm gonna take away the nerves real quick. When we zoom into this area here, we can get compression to that disc, and that disc can bulge out a little bit, just like a little
Right.
bit like this, and the nerve runs right here. So if we
Right.
get that irritation to that nerve, look at that, we can irritate the nerve that then goes down and into the leg. So we can kind of
Okay.
follow it down. And so depending on where we're talking about or which nerve we're talking about, it can radiate down the front of the groin, it can radiate down the front of the thigh, it can go down to the back. Most of the time it's the L5S1, and based off of your case and stuff like that, we definitely have some uh, potentials for that to be an issue,
Okay.
you know. Um, but I'm just gonna go back to your chart while you're here, and give me 1 second. You still there?
Yep. I'm here.
Okay. I thought I xed out. That's what I asked. Okay. So and then your so pretty much, and then the neck and the stuff like that, it has some similar compression, but a lot of times it's as a result of over stiffness in the mid back.
Yeah, I feel that a lot too. Like like in my mid back going up to the top of my neck.
Yeah, and that's often as a result of again compression to the nerves and to the neck, because a lot of times people will feel this like irritation like right here in between the shoulder blades here,
Yeah.
and that's
Yep.
usually as a result of the neck being drawn forward a little bit too much, almost like if like you understand construction. So imagine if your head's over here, that's pretty decent, but
Yeah.
if your head is over here, this lever point right here takes too much force. So now these muscles have to work a little harder. That compresses the joints and the spine, and then that can irritate the nerves that go down into the back here.
Yeah, like I'll notice that like also if I'm sitting around and if I'm I got my head down looking at my phone, I'll notice it more.
Exactly. So that's
Makes
again
sense, right?
flexion. So in that low back pain program, that actually has mid back and stuff involved. I think for somebody like yourself, we're gonna have to give you a little bit more isolated neck things in addition to the lower back, because the truth is, you and everybody had like like believe it or not, we're designed to have a very mobile mid back here.
Yeah,
We're supposed to be able to extend, flex, and twist and turn. The problem is that we get really rigid through here, and then the neck gets really too much movement. If this can
right,
just stop as much movement and be a little more stable, this part of the neck should be a little bit more moving, and then this area would be a little bit more mobile. You'd have mobility here, so movement, and then you would have stability here, and then you would have mobility here. Problem is that people have the stability. They have too much stability here, which then things have to move a little bit too much more here,
okay,
and that's
makes
where you
sense.
get the pain. Because a lot of times those nerve pains that go down to the arms, the fingers, into the mid back, that's as a result of too much movement at the lower cervical spine where all those nerves are. And I can
I know I notice sometimes if I sleep on my one side, I'll get that tingling sometimes going down my arm into my fingers. Make
yeah,
sense?
yeah. Which side?
If I sleep on my left side, and I'll like roll on literally like on my arm because I don't really sleep the way like I should with back and neck pain.
That's okay.
I'm the worst. So sometimes I'll feel it and I'll wake up. I'll feel it going through my arm like into my fingers.
Does it go into these two fingers, the first two, or the second two, or
Uh,
this one? Which one? Which finger?
I would say the last two, the
So
last
the
two on the
ulnar.
left.
So if
Yeah.
we follow the ulnar nerve all the way down, or the C8 is what we call it. So that would be a C7 type of nerve root injury. We can follow
Right.
that all the way up. So it'll come up to like this part of the area. If you get rid of this ligament real quickly, you can see
Right.
how this would branch. This would branch all the way
Right.
down to
Right.
these fingers. So let's follow this nerve all the way up and where it goes. It goes down to the back of the elbow. This is like the funny bone. But what happens is that you
Yep.
will feel it run across the bottom, or like an almost like a rubber band, like pulling tension situation by
Right.
your tricep.
Right.
And then a lot of times, what people will feel it up into the shoulder blade or the elbow. See how it runs down the shoulder blade?
Yeah. Yeah. Exactly.
And then
Yep.
people will feel it. They won't really feel it through this area, believe it or not. They'll actually start to feel it more into the neck because the muscles will guard around the neck. And see, here's, like I said, the C8. And here's the
Right.
C8 spinal nerve right there. So,
Right. Right. Makes
so I'm gonna
sense.
have to give you. So we're gonna have to give you the mobility, and we're gonna have to give you a neck course too, like a course of action
Yeah. I
for
would
the
say so.
neck.
Yeah.
So there's gonna be a
Because
few exercises.
like I said, it's not constant, but it's back and forth between the neck, the back.
Well, here's the thing about that. That's actually a really unique concept that I talk about with my patients. It's like, why the heck is it my neck one day? Why is it my
Yeah.
shoulder the next day? Why is it my mid back the next day? And why is it my low back the following day? The one of the reasons can be is just one, insult to injury, right? Maybe you're lifting a little heavier weight with your low back and you're not using your neck as much. And then the other
Right.
reason could be a very, very common one is like if somebody punches you, if your son punches you in the left shoulder and then punches you in the right, which one do you feel more,
Right.
right? It's usually the last one. The last one is because the brain literally can't interpret pain as well when it's coming from multiple stimuli.
Right.
So people will tell me a lot, like when I help them clear up their low back, they're like, "Yo, my neck is getting worse," and I'm like, "No, you always had neck pain. You just finally cleared up the low back, and now you can process the neck pain better."
Yeah. I feel like I don't feel it on the same days.
See what I mean?
Yeah.
So what we
Makes
need,
sense.
so the question would be then, what the heck do we want to target more
Right.
of? Because I always do, like, let's do the 80-20 principle. Let's spend a little bit more of our time fixing a primary problem, and then we'll do some relief stuff on the other end. But
Right.
A true positive, a good quality program should be able to address multiple problems at once.
Okay.
And that's where we'll do that. So we'll give you some neck relief exercises while really getting into the meat and potatoes for the lower back, because the lower back has a higher rate of debilitation for somebody in your work field.
Okay. Yeah. Yeah. Makes
So
sense.
I'm
Yeah.
gonna just any questions on that?
My lower back is more, I guess, while I'm at work. But like now, like when I'm sitting around, it goes back and forth.
Yeah,
I feel like my
walking is
lower back
pretty.
will be more while I'm working.
Yeah, well that makes sense. You're
Because I'm not like slouched down. I'm not looking at my phone at work.
well, you can't. You're pitched up, hundreds of
Yeah.
1,000 feet in the air.
Yeah. Yeah. Exactly.
Literally, that's I don't know how you do that, but that's a different story.
Crazy.
I don't even know how the hell you guys do that.
You gotta. When I first started, I used to be scared of heights, but then you get like a thrill from it. It's amazing.
Man. I mean, I'm sure you do, but I mean, and I'm sure you're well protected. You probably have double harnesses and all that too.
Yeah. 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 All that's. So.
Yeah. So, any questions on about the back or the neck issue that we're dealing with?
No. No.
All right.
Everything's pretty straightforward.